Rhinoplasty is a procedure that is meant for reshaping the nose. Every ethnicity and every person have different shapes of their nose, and sometimes people don't feel comfortable with their noses because it is the most prominent, the projecting part of the face. So in 2.5 hours of surgery, you can really transform the way a person looks at themselves. I think in plastic surgery, it is one of the most difficult operations to perform because you can make one change and 3 other changes will take place in the nose just by virtue of what you have done. So you have to be extremely precise. There are different types of rhinoplasty approaches. There are mainly 2. One is a closed rhinoplasty, one is an open rhinoplasty. I like to perform the open rhinoplasty because I like to see each and every step that I'm doing and where my suture placement is. And I think that's one of the most commonly practiced approach. There are, however, a few surgeons who can do closed rhinoplasty. Now, what's the difference between a closed rhinoplasty and open rhinoplasty? In a closed rhinoplasty, the incisions are only made inside the nose without any external scar. In an open rhinoplasty, there's a small scar right at the base of the nose that nobody can see. So, but it gives you more exposure, you can look at the anatomy and analyze things very well and then correct them accordingly. And during rhinoplasty, it's very important to reconstruct the nose at the same time. It's just not cutting and reducing, it's about stabilizing the nose because the main function of the nose is to breathe. And if they become breathing cripples after 1 year, what good is a rhinoplasty if they can't breathe? After rhinoplasty, the patients have a splint on the nose that stays on for a week, and there are sutures that come out after a week. So after 1 week, there's going to be some swelling on the nose, but they can go back to work at that stage. And they can go back to school if they're at school. And we just advise them not to engage in any strenuous activity, any working out for a while, just normal walking. Most of the results you will see a major change in the shape of the nose immediately after surgery. And sometimes it's very heartwarming to see tears of joy in the patients when they see what when they look themselves in the mirror. But we do advise them that this is not the final shape. It's going to keep getting refined over time. For about 2 months, most of the swelling in the upper part of the nose is gone. But the tip swelling really takes about 1 year for them to see the final result. You can even extend it further. The nose keeps changing shape. Even after 10, 15 years, there could be some slight changes in the nose. But for most of them, 1 year, we tell them 1 year is a good time for them to see what their nose is going to look like. If it's done properly, breathing is never an issue. However, there are some approaches that don't take into account the reconstruction, and those patients will have a hard time breathing after a year or so. After surgery, the patients can have some bruising because many times to change the width of the nasal bones, you have to fracture the bones and bring them together. And that can cause some bleeding, internal bleeding around the bone side, and you'll see the patient will have bluish discoloration of the cheeks. But that takes a couple of weeks to go away.